Welcome back to 20 Clinical Pearls in 20 Days. Today we're going to talk about how in this world of cardiovascular issues that people are having, sometimes less is more, and oftentimes it doesn't even require supplements, which is somewhat heretical in the nutritional and functional medicine industry. Now here's a question. What do you do for somebody who has either hypertension or an increased pulse pressure, sometimes also called systolic hypertension? Very often there's going to be diet, usually some kind of lifestyle interventions, maybe some exercise, but maybe there's some other things that we can do based on the evidence. It turns out that hand grip training isometrically, there's a number of great randomized controlled trials that show that it's actually pretty successful at lowering systolic blood pressure, diastolic blood pressure, might even have an impact on central blood pressure and a number of the indices associated with arterial stiffness, which is associated, of course, with increased pulse pressure, which by itself is an independent risk factor for some kind of cardiovascular event. Now, all of these use what's called a dynamometer. And what you're supposed to do is figure out your maximal voluntary contraction. How hard can you squeeze that thing? Do it a few times, get an average, and then here's the general protocol that most of these studies follow. Squeeze at 30% of your maximum voluntary contraction. Hold that for about 2 minutes at that 30%. Take a rest. Do the other hand. Take a rest of about a minute. Go back and forth for a total of 4 times with each arm. Do that 3 times per week for at least a couple of months based on most of these studies, and the results are pretty powerful. Now, there are some contraindications. Look at the studies. Extremely high blood pressure, syncope, some of these things aren't a good idea. One question people have is, well, can I use the little grip trainers that we used back in the 80s for those of you who are around then? And the answer is probably not, because here was another randomized controlled trial that said that supervised isometric training reduced blood pressure indices, but at-home versions did not. That's all right, because nowadays they have a digital dynamometer. These are pretty accurate, 20 or 30 bucks off somewhere like Amazon, and all you need to do, get your maximal voluntary contraction. You want to make sure that it has a real-time force display so that you can actually contract this to 30% of your maximal voluntary contraction, and just give that a try. Anyhow, so if you like this kind of information, we are loaded with it. I included this in our brand new course, the Cardiometabolic Blueprint, which is a part of the Advanced Mentorship program at metabolicfitnesspro.com. We'd love to see you there. It cuts through all the noise and the garbage of the functional and the nutritional medicine industry and gives practitioners evidence-based things like this that you can actually use to help improve your patients and clients. Check us out. We'd love to see you there, and God bless.